Last year, for example, we had an outbreak situation. We had a buccal diarrhea outbreak in our ICUs, and that time our IPC leader, we have a teams there. So a leader actually, it synergizes and coordinates between an individual, a team level, every level. So that way, IPC focal person has a very important role.
In 2012, in Barbados, there was an outbreak of carbapenem-resistant Klebsiella pneumoniae within our hospital, which affected both the adult population and the neonatal population. At that time, the infection prevention control program consisted of one particular nurse. Following the outbreak and following the concern of public and the political scene, what we did was to fight for the whole idea of infection prevention control in the hospital, knowing that it is the backbone within hospitals.
You necessarily have a vision that you share with your colleagues.
The vision, I think, is quite important, and that actually comes only from one important factor: their own personality and passion.
Apart from vision, they must have a sense of where the program needs to go, where the program needs to start, where it needs to go.
You are an advocate between the management and then the staff.
We have to talk to people at the frontline staff.
IPC leader has to be a team man.
IPC leader should be trusted, tested, and demonstrator also.
IPC leaders should be smart, should be assertive, should be good communicators.
One of the most important things that leadership drives in resource-limited settings is actually political will, the ability to get things done. I think if we're going to focus on leadership within that particular arena, that it is important that that focal person be driving both the national programs, the institutional programs, and in the case of smaller countries, for example in the Caribbean, driving regional programs.
When you look at a developing country like Ghana, where I have worked, we started from more or less ground zero. There was virtually nothing. And I personally took IPC as a baby. I call it a baby because I brought it from its infancy to this, of course, with the support of a core team that I just handpicked because of the interest that it showed in IPC. For more than 15 years, we were not even getting the voice. Then came Ebola. Then it became a priority for the country. And then we started getting leadership support at all levels.
And I think one of the things which is very important for sustainability is to actually convey the message to all the IPC leaders that for their sustainability, they have to pass this knowledge. So the people, I think, who are retiring, they must actually start succession planning who will be the next person when they go. And I think that's actually quite important.
So we have made a point that once we have a joining session starts, we reinforce each and every program and intervention by hand. Our IPC focal person goes to each and every ICU and ward at that particular time to, kind of sensitize all the new group of people, and also in a way that we have every month we have kind of an hand hygiene champions or something like that to make the program really more encouraging and sustainable.
The sustainability can be ensured when there are benchmarks, and with the benchmarks you're at par with the benchmark. So this makes it easier for the higher ups to understand that this is something that needs to be sustained.
For the past 30 years, I've seen so many patients with infection and the consequences of those infections, not only on the patient, but also on the family. I think at this moment, working especially in low to middle income countries, my experience is that a lot of infection control practices are ritualistic and a lot of money is wasted in the practices which are not evidence-based.
It's not really that we're resource limited, it's that we misuse resources. And as a leader, I recognize it's important to channel those resources to appropriate use to get the appropriate outcomes, which ultimately in infection prevention control is to reduce both mortality and morbidity in patients.
I think IPC leaders are not born. I think IPC leaders are made, and IPC leaders are groomed.
It's my motto in my life is to save human life by any means, also to serve the people as maximum as possible.
The community of IPC leaders has grown incredibly fast over the last few years, including in countries and settings with limited resources. I have had and continues to have the privilege to meet many of them all around the world. I learned a lot from their creative solutions and fresh, enthusiastic experience, which has frequently started from outbreak responses. It is now crucial to build upon this leadership to fully embed IPC in health service delivery. Let's continue to save lives in everyday care practices.